Good afternoon, folks in Daviess County. It's about 1 p.m., a little later than we normally have these updates, but I've been on Zoom meetings all day long talking about various issues. And I'm pleased to have the Daviess County Fire Chief, Jeremy Smith, join us today. We'll get to Jeremy in a little bit. One of the things I always start by is taking this mask off, and I wear it to let you folks know how important it is to wear these masks, to social distance, to sanitize your hands, and to avoid larger groups. Today, the Green River area had 264 additional COVID cases. Unfortunately, we had one related death, and that was in Webster County. So far, there have been 16,289 COVID cases in the district. The district-wide total of cases that have recovered are 12,014. That's good news. 74% of the people who were diagnosed with COVID have recovered. There are 54 cases that are currently hospitalized. I always hate to see that number being high because that's a predictor or an indicator of the number of folks who could possibly or potentially pass away from COVID. We have had 273 COVID-related deaths in the Green River District, and of those, 123 have occurred in Daviess County. So I would ask that we just take a moment to remember all those folks who won't be with their children or with their grandchildren, or mom and dad won't be there, grandparents won't be there. In Daviess County, we have had 7,328 confirmed cases, 5,448 have recovered. Again, that's some good news. Currently, we have 26 hospitalized, ever hospitalized 278, and 123 folks have passed away. If you do the math, that means that we have 1,757 active cases in Daviess County right now. Confirmed active cases, I suspect, when in talking with Clay Horton, the director of the Green River District Health Department, the number of cases probably are 3, 4, 5 times higher than that, just because the asymptomatic folks or folks who have a little stuffy nose have failed to get tested. As always, you can go online and you can check out the testing sites for the Green River District Health. You can also get information about flu shots. Just a little information on the COVID-19 vaccine. The Kentucky COVID-19 vaccine dashboard and information are on gov status, status.egov.com/Kentucky-COVID-vaccine. That's a lot to remember. You folks aren't going to remember it. If you want me to give it to you, email me and I will give it to you. But if you go on the Kentucky COVID-19.ky.gov, there's a link that will take you there. There's a lot of good information. I was there this morning, by the way, and Daviess County has gotten back down below 100 cases per 100,000 in population. I think today we were somewhere around 75, 76 cases per 100,000, which is really, really good considering that we were at about 105 a week ago. So we're trending in the right way. If you look at it, just think about it. We are day 20 after the January 1st, the New Year's Day parties and celebrations. We're 3 weeks out from Christmas. So we should start seeing a trend dropping, because there were a lot of parties and large family gatherings and things that help to spread the virus. The Kentucky COVID vaccine hotline is 1-800-722-5725. That's 800-722-5725. And they can answer general COVID-19 questions about the vaccine. The Green River District Health Department continues to vaccinate healthcare workers and first responders. You can visit their website, and I don't know how old this is for them to have gotten it, but it's healthdepartment.org. healthdepartment.org. And you can go there and register your organization if it's a particular group of teachers, a particular group of first responders. Information on COVID-19 vaccine at Deaconess and Henderson County and Union County can be found also on the web at deaconess.com/coronavirus/COVID-19-vaccine. Here at Owensboro Health, you can find information on their website, owensborohealth.org/vaccine, or you can call a central scheduling line. Hopefully it doesn't crash now. That's 270-685-7100, 270-685-7100. Ohio County Healthcare is currently scheduling for patients 70 and older to receive the COVID-19 vaccine. And to schedule there, call 270-215-9082, 270-215-9082. Everybody's been asking that we be patient. We could vaccinate more people if we had more vaccine. The state gets about 54,000 doses of vaccine each week, and they allocate it out among the various counties, health departments, and such. Those vaccines are separate from the federal program that's going on at the pharmacies, Walgreens and Rite Aid, or whichever one Walgreens didn't buy out. They have a federal contract to vaccinate the people in nursing homes and in assisted living. The hospitals are vaccinating frontline healthcare workers, first responders, and the health department is doing some of that. They're trying to get to folks like some of the assisted living homes that don't fall under. So there are just a myriad of information on the sites I gave you. We are working with the health department. Hopefully the United Way and some other groups will be able to get together and have a community response through 311, where you would just dial 311. Right now you can dial 311 and you can find out what help is available versus for rent, utilities, food, those kinds of things. And we thought if we can, and Clay Horton with the health department will let us know, but we're trying to gear up to provide information through 311. I think that's all I've got to talk to you about. So Jeremy, are you ready?
Yes, Judge.
All right. Well, I'm glad you might put that mask back on. You look better before you talk.
Appreciate that. Appreciate that.
Is the Daviess County Fire Chief. Jeremy oversees 2 fire stations that respond on every call in Daviess County, as well as is liaison to and oversees training and all the things that go on with our volunteer stations. So I thought it would be nice if we had somebody with us today. Number one, to try kind of talk to us, Jeremy, about how your guys got vaccinated. I know that we have had 1 or 2 cases of COVID within the fire department. How have you responded to that, and how have you scheduled? I know that you guys, Daviess County Fire Department, I think, is the only fire department that runs paramedics on their emergency responses to accidents and medical emergencies and those kinds of things. And when I say that, it's fire departments, not ambulance service, but fire departments. And so your men get involved with a whole lot of sick folks. And some of those folks have COVID-19. And you go in there, you still treat them. You don't shy away, you don't back away. And thank you for that service. And be sure to thank all your guys and all the first responders. So tell us, let's start out. You guys are first responders. Did you guys get a shot yet? Have you had the vaccine?
I've had my first shot administered. I will actually be receiving my second dose Saturday. I think 14 of us have gone through the first regimen. I did have 3 members who have tested positive for COVID, so they weren't really eligible for the vaccine because they already have the antibodies. Right now we know we are waiting on some more doses. I do have some who have reached out wanting to go in the second round as they become available. But we have a little over I guess it'd be right around half our department right now have had their first round.
How many total folks do you have in your department? Paid firemen.
We have 29 here, along with the 250 volunteers.
Right. Okay. So volunteers, are they getting vaccinated as well?
There have been several get vaccinated. I do not have a number count on that. I had several chiefs. I know several I ran into that day were from the Sargo Fire Department. Were there the day I got vaccinated. I'm not for sure the total number that did.
Okay. Now, there has been no mandate that any man in your department be vaccinated. Is that correct? It's all volunteer.
That is true. That is true. Yes.
Okay.
Yes. And we have, the one thing I can attribute to, my department not being hit hard as well as with the volunteers. We went into a strict decontamination of all of our equipment when we go into, especially when it is a known COVID patient or a high risk COVID patient. We went into special procedures and began to adapt as we learned more about this over time. But the guys, they'll wear gowns, they'll wear masks, they'll wear they'll wear face shields at times, especially on our high risk patients. And they're dealing with these, one-on-one, sometimes being in with them 5, 10, 15 minutes, sometimes on our sick patients riding all the way to the hospital. And I think that, showing that's why to me it shows the importance of masks and washing your hands, deconning, staying clean. Because I, knock on wood, I haven't had to quarantine a whole shift yet. I may have had 1 or 2 with it. Can't even confirm they got it here, but we have been blessed to not lose a shift yet. And I think it's due to my people being diligent, along with the volunteer stations who have been on board with wearing masks and deconning. We send limited personnel into a residence. We'll limit it to 1. If we need another one, we'll send that other one. But we try to keep it as minimal as we can, and my guys have done a fantastic job doing that.
Do you or your men, when you're dispatched out on an emergency call, do you receive any advance notice that there may be a COVID patient in the home that somebody has reported? Family member called, said mama's sick and she's got COVID. Do you get any advanced warning like that so you can take extra special precautions? Or, and I think I know the answer, you take extra special precautions with every call.
That is correct. With what is going on nowadays, when I got into fire service 28 years ago, you may not even wear rubber gloves on every call.
Right.
Now we do. It's a no-brainer. We've done it for years now. And it's kind of like with the mask and the precautions we take those extra precautions on every call because it's unknown. It's like you was talking a while ago. Some of them are asymptomatic. We do get certain notifications as far as, when we know their difficulty breathing, running fevers, when they're showing these signs and symptoms and they may tell us that it could be a possible high risk. Sure, you may even take the utmost, but yes, on every call, we're treating them as a symptomatic patient. And I think that is what's kept us from being hit hard here at this department.
Did I misspeak when I said one of the few, if not the only paid fire department that has a paramedic on each response for medical emergencies?
We are one of an elite group that are an ALS, a paramedic basically saying with non-transport, where we respond, but we don't actually transport the patient. My medic may ride in the ambulance to assist or something of that nature on critical patients. But we are one of few. I think there may have been a couple that have now come along. We were one of the first in the state of Kentucky for sure. But yes, we are kind of an elite class, what we are able to supply our residents here in Daviess County to give them this extra care.
Feather in your cap. ALS?
Advanced life support. Yes.
As opposed to an EMT or an EMS.
Which is the basic life support of BLS. Yes.
BLS, right. So
yes, sir.
Paramedics, you can talk back and forth to doctors, inject drugs, do a lot of things that EMS can't do. our EMTs can't do.
Yes, sir. They could administer cardiac drugs, things of that nature, stuff to limit pain, or if you fall, break a hip or ankle or something of that nature, they can administer medications to those patients while working along with the ER docs at the hospital.
Jeremy, this is just an aside, doesn't have anything to do with COVID, but tell me a little bit about how the fire departments out in the rural areas outside the corporate limits of Owensboro. And by the way, if you're requested, you come into Owensboro as well to lend assistance. But how are those responses? So we come down, we've got a issue in Stanley. Somebody's having trouble breathing in Stanley. So we've got a volunteer station down there. Do they just dispatch the volunteer station?
So we are divided. We have 10 volunteer stations in Daviess County. We have the 2 paid stations. The one located on Highway 54 is our east station, and we have our airport station located right there at the airport, right outside the terminal. We have the 10 stations, and we divided that kind of right down the line, the middle of Daviess County. It's kind of follows along the Natcher Parkway back over and the way it angles out southward. So basically what happens is if it is in Stanley, Stanley will be dispatched along with my West County crew at the airport station. If it's a medical call, Stanley will respond. And, you know, a lot of times they may have a first responder get there. It is a little bit for us to drive out there, but they'll let us know what they got, kind of give us patient updates, and then we will come in, you know, with a medic and an additional EMTs to assist them along with the ambulance service on that call.
Okay. You know, I just got a text from Jordan Rowe. He said, Judge, can you move closer to the screen? They can't see your pretty face. So he must not be wearing his glasses today, right, Chief?
Yeah.
Oh, be careful what you say.
Yeah, I'm going to hold my tongue.
Chief, tell me about half of your staff has received the vaccine. Any adverse reactions to your knowledge?
Just other than a few sore arms, no adverse reaction, usually gone by the next day. You know, I heard no negative impacts from those vaccinations.
Okay. Well, you know, and I received my vaccine a couple of weeks ago when those 70 and older could do it. So did my wife, and no adverse reactions on our part other than every now and then she thumps me, and she seems to thump a little harder now than she used to be able to. So you're out there, you're trying to provide the same service that you were before. It has to be cumbersome. It has to be slower. It has to be, it just is a burden trying to do all those things, wearing all that protective gear. Or does it seem like nothing? Because I've seen your turnout gear, and I don't know how you guys wear that for very long when you're fighting a fire or doing otherwise.
Well, to me, it's, you know, it's a minimal impact. It was a change in the beginning just because it is different, but it's no different than anything with us. It's a minimal impact to me to see what the overall gain is. Now we don't even notice it. We wear them like it's second nature. And getting into the habit, the muscle memory of knowing to put that on, sometimes you got to turn around and walk back to the truck. But that's what I told my guys. I said, you know, it doesn't matter if it's me. It doesn't matter if it's one of your assistant chief. If it's an officer, say, hey, chief, you forgot your mask. Remind one before they get into the residence, because it's so, you know, we do get complacent because we're so used to stepping out of a vehicle and just walking to a residence. And us walking, you know, watching over each other as a team effort, I think it's not cumbersome at all to us. We do it as an everyday practice now.
Well, Chief, I want to thank you for taking a few minutes out of your busy day to come on and talk to us a little bit about how COVID has affected the fire service, some of our emergency responders. I just want to let the folks know that next week on Wednesday, don't know whether it'll be 11 or 12 or 1, but it'll be somewhere in that time slot. We're going to try to have either a restaurant owner come on and talk to us about how COVID has affected their business and the lives of their employees, or perhaps we will be able to bring on the college presidents of Wesleyan and Brescia and OCTC to talk about the changes that have occurred in college education, in higher education. I know we had we had the Owensboro Public Schools, Daviess County Public Schools, the Catholic schools on probably a month, 6 weeks ago, talking about how it had changed education in their world. Now let's talk about how does it change education in the world of those adults? Because we are now, you know, when we send them there, they're 18, mind of their own. You can't treat them like you treat a 6-year-old or a 10-year-old. And we want to talk to them about that. So there's a question, I guess, about the vaccine supply. When will the states supply more? I can tell you this, the governor, again, we get about 54,000 doses a week, and that's to be divided up amongst the 120 counties, divided up again amongst health departments and other people who are doing the vaccinations. I do know that the governor has requested more vaccine. Whether we get more or not is yet to be seen. So next week, the 27th of January, will be Pat Bosley with Moonlight Barbecue. The following week will be college presidents. I didn't read that question completely, Jordan. Yes, the website for Owensboro Health says the appointment scheduling is on hold until they receive more vaccine. I would just encourage you to keep going back there every day to see when they will start the vaccinations again, or call that hotline that I gave you the phone number. So with that, Chief, thanks, and be safe out there.
Thank you, Judge. You too.
Folks, until next week, you guys be safe as well.